Okay, in this video, it is about how forcing or coercing psychiatric medications is immoral, wrong, and unfair, and what the just punishment should be for. Also, getting people to sign superficial consent forms, tricking them into signing it, say in a psychiatric ward, is extremely unfair. There are experiments at psych wards that people are coerced into signing contracts that consent forms that allow them to do it legally, but it's extremely immoral, and it also forces the victim, the consentee, to take other paths if they want to get justice, and I highly recommend they do so. This video is also about gang stalking and why being in a secret group affiliated with psychiatry or any other secret society that's involved with political manipulation is a form of self-harm. And I will prove that beyond any doubt by the time this video is over, and I will fill in the blank in the comments. So if you look at the different forms of stalkers, there's the vengeance terrorist stalker, there's the intimacy-seeking stalker, there are the resentful stalkers. There's also the political stalkers who stalk people for a cause, such as we've seen with the anti-abortionists, some of them stalking the abortion doctors. And all these things play a part in gang stalking, and it's quite funny how we have traitors who say otherwise. According to a U.S. Department of Justice report, 18.2% of people reporting they've been stalked report they were stalked by report that they were stalked by 2 people. 13.1% report that they've been stalked by 3 or more. And in the same breath, you'll have people who cite a 1999 study by Path, Mullen, and Purcell, complete traitors I might add, and a Sheridan and Blau study which says that 11.5% of claims in a sample of 357 reported claims of stalking were false, but their report is more accurate than what was being said by Path, Mullen, and Purcell. They're the traitors. And so they basically say that gang stalking is not real, and that there's conspiracy theories, and electronic harassment is not real, psychotronic weapons is not real. They didn't bother to look into it. Typical of psychiatry not to bother to look into the things that prove them wrong, even though they're blatant and in your face. It's quite facetious of them. So, needless to say, this has a horrible effect on the efficacy of psychiatry. Their ability to produce a positive result or even a desired result. So there are also the different types of stalkers. Political stalkers, people who stalk people for a cause, and this is what gang stalking is first and foremost. It's also a form of vengeance or terrorist stalking. There's an aspect of intimacy-seeking stalkers in it. Some of these people are raped. There's also resentful stalkers. It's funny how there's some of the stalkers consider themselves feminists, but their victims are mostly women, and many of them are raped. Completely sick of these people to pretend to be Christians or feminists or any kind of honorable political idea or perceived honorable political idea. Because I don't believe in feminism. I think it's sick, but I think that's an irony that needs to be noted. Now, let's talk about psychiatry, shall we? CBS article, debate over psychiatry Bible DSM-5 grows days before release. So this is the latest version of the DSM, and there's a debate over it. And lo and behold, NIMH Director Thomas Insill wrote a statement. Now, who is Thomas Insill? Well, he is the director of the National Institute of Mental Health. And what does he say? The weakness is its lack of validity. Unlike our definitions of ischemic heart disease, lymphoma, or AIDS, the DSM diagnoses are based on a consensus about clusters of clinical symptoms, not any objective laboratory measure. In the rest of medicine, this would be equivalent to creating diagnostic systems based on the nature of chest pain or the quality of fever. I think you should read the articles. I just read you the title. It's by Michael Castile, May 15, 2013. Not exactly an ancient article. Okay. I'd like to draw your attention to ncbi.nim, I believe it is, .nih.gov, Indian J Psychiatry, Boundary Debates, The Challenge of Psychiatry by Philip John. The boundary between behavior and biology is arbitrary and changing. It has not been imposed by the natural contours of disciplines, but by lack of knowledge at the time. This is from 2010, but as you can see, not much has changed. I'll give you a quick excerpt from it and leave it there. I've more than proven my point. The dualism between psychology and psychiatry, too, is a derivative of the faded mind-brain issue, which once created professional contest and personal vanity within the field of behavioral sciences. Psychiatrists must never disregard or diminish the environmental influences in the etiopathogenesis of psychiatric disorders. Nevertheless, those in our own profession who pretend that psychiatry is not a branch of medicine in order to facilitate multidisciplinary approach contributed to the abysmal isolation of psychiatry from the rest of medicine. As a consequence, even physicians sometimes fail to distinguish psychiatrists from a psychologist. So what has happened here is the vanity and the political nature of psychiatry has destroyed it, and as a result, psychiatrists themselves are upset. Why? Because they are not recognized by a lot of physicians as a valid science. That's what their peers think of them, and that is not me saying that. That is them complaining of it. Of course, I disagree with the person on the notion that psychiatry is a valid science and that the other physicians are wrong. But okay, that still more than proves my point. There are boundary debates, and there were debates over the very definitions of mental disorders themselves. We still don't understand the nature of people. Well, you don't. I understand it better than psychiatrists watching this. And we still haven't defined reality. Probably never will. So that leads me to the end of this video, which is, how can we then force medicate anybody, especially someone who is quite logical, quite capable of making their own decisions? If we have them sign consent forms because we deem them capable of making decisions for themselves, if we pass legislation that says, hey, you don't have to take the medication in the psych ward unless the psychiatrist there says that you are incompetent or incapable of making these decisions for yourself, then how can we turn around and then say the same person that I said was competent of making decisions for themselves needs to be covertly drugged because it's in their best interest? Trick them to signing in a consent form, which anyone can be tricked. Some of you might say, why don't you read what you sign? Well, when you are upset, we'll just say that the normal person is upset and it goes into this situation, and you sign consent forms, you sign forms to get into the hospital. They say your time doesn't start until you sign these forms. Automatically there's an incentive off the bat to just sign the forms and keep it moving. And in many cases, one of the forms I've signed, they explained it to me as, well, we need to sign this form, to get you transferred in. I'm in a rush. The guy told me that he's in a rush, and he was from one of the hospitals that I was going to be transferred to. And so I signed it without reading it. And they might think that they were smart for this, but what they had done is it created the circumstances for me to seek justice other ways, which leads me to the end of this video. I promise that I will not